Hello, I'm Nelson Liu, and welcome to Western Perspective. Thanks for joining us. Well, COVID-19 has hit local businesses during the pandemic, with forced lockdowns and restrictions affecting many, including hospitality and entertainment venues. Coburn Ice Arena is one of them. The rink facing reduced attendances and less revenue, including this last lockdown heading into the school holidays, while facing the fear of closing for good.
Yeah, so today's a standard school holiday session, except it's just got less people in it.
Is it normally this busy?
It's normally a lot busier than this. So this is obviously the restricted 150 persons rule that the government's got in place at the moment.
I spoke to Managing Director Calandra Barrett about the impact the pandemic and the lockdown has had to her business. What kind of difficulties has the rink faced following the announcement?
So we had to chuck out a lot of food. We did donate a lot of food to charity, but it's a tough call. My staff, anyone that was a casual, obviously didn't get paid while we were closed. If you didn't have any annual leave left, so we've got over 100 staff, so they all didn't get to work, which was not great. We had to cancel lessons, birthday parties, so a lot of kids would have been disappointed their parties were cancelled. With the lockdown, because we were closed obviously for that 20 packs restriction too, it wasn't enough to open, so it would have been over 100 grand we were down that week.
Outraged at the fact that, first of all, that you can't open, you've lost a lot of money, you've got no business running, and you can't be compensated because there's no compensation scheme.
Yeah, it's really disappointing, and it feels like big business gets to still open, and then we don't. It's just, I don't know, it's not good. So,
how much of an effect has staff shortages been, given that you can't pay them?
Yeah, so staff shortages in terms of the labour shortages, that's something we've been talking about for a long time, and it's only starting to be covered in the media. Like the chef shortage is just ridiculous. They should really get on to being able to bring them back in from overseas. If you look at the number of apprenticeships since 2010, they've dropped from like 20,000 apprentices in WA a year to 2,000. So people obviously don't want to work as a chef, like Australians don't want that work. And now they've closed the borders, we're all fighting for the same labour that's already here. So that's making it harder. And then if you put on top that hospo gets closed down, the chefs are going to go and work in aged care and other places where they're not getting closed down, and it's a more stable job. So we're finding it's like a double whammy, the labour shortage plus certain sectors get closed. So staff are going to move to more reliable industries where they are not affected by lockdowns so that they can still get an income.
Is it a big impact given that you're not just an ice rink, you're also a restaurant as well? So is it a big impact to you? Yeah,
so we have a restaurant and a cafe, we have a retail store as well. Even just getting receptionists, we're finding that that's really difficult. It was never difficult before. We've been recruiting for reception for 6 months. The labour market is very tight.
What's your call to the government?
The government had a $5 billion surplus, so why aren't they spending money and getting this quarantine facility up and running? Don't wait for the feds, get on with it. You can do like a mining camp, you can put something up quite quickly. Even if they wanted a dedicated quarantine facility, I don't know why we wouldn't just get on and set up something temporary in the meantime. The surplus is there, it's WA people's money, just get on and do it.
Given that you're talking about your business is being impacted, what do you want to say to Mark McGowan?
Just sort it out. We need to move forward. We can't keep suffering these lockdowns. There has to be a different way to manage it. So whether that's setting up the quarantine outside of the city so we don't have these outbreaks in the city. We just need to stop chit-chatting and fighting with the federal government versus state and just get on and do something about it.
And now, here's this week's COVID-19 commentary with AMWA spokesperson, Dr. Andrew Miller.
Hi, unfortunately been a bad week for COVID in Australia with the news that the Delta strain infection is spreading in the community in Sydney despite a moderate lockdown, and there's a lot of talk that the lockdown needs to become more harsh, because what we're seeing is the number of cases that are diagnosed of people who have been circulating in the community, that is, it's not close contacts of previous people we knew about, but these are new cases that have caught it when out and about, is going up, and it's doubling every few days, those numbers. So whilst they don't sound like big numbers at the moment, only 34 cases or so obtained in the community from testing found yesterday. If that keeps on doubling every few days, then very soon you're into the thousands of new cases. And what we're seeing with this strain is possibly an increased rate of admission to hospital and ICU, and possibly a greater attack on younger people. Although COVID, of course, around the world has always affected younger people as well as older people. It just tends to have worse outcomes in the older age groups. But around the world, the data shows that about 1 in 500 people under the age of 40 who get COVID will die from it, unfortunately. And that's quite high, particularly when we've been talking about complications of AstraZeneca vaccine, around 1 in 50,000. This is 1 in 500 who die from COVID. So that's really worth putting into perspective and understanding that the shocking news that a teenager is in the ICU in Sydney already with this disease, very, very unwell, is not at all unusual for what's been happening in the rest of the world. So any idea that this is just a disease of the elderly and that for the rest of us it's fairly benign is completely untrue and always has been untrue. The trouble with Delta, of course, is that it seems to be spreading more rapidly. We're seeing high rates of infection amongst all of the household contacts of people, so it may be a more efficient virus at spreading, and it certainly doesn't seem to be less damaging to people when they get it. And so we may see other mutants in the future that are less damaging, but this particular one, just as bad as the previous ones, unfortunately. So as far as Western Australia is concerned, we're moving towards a period of having a more open community here, which means, of course, that we're going to have to be stricter about our borders and making sure the disease doesn't get here in the first place, because we're basically sitting ducks within this state. If this kind of variant gets out there into the community, you can see at these relatively low case numbers in Sydney that the number of contacts for each person is very high. Having things like department stores and all sorts of retail stores open and schools open, it's just not possible during a lockdown to bring Delta variant COVID under control in any city. So unfortunately, it's going to be prolonged now to try and bend that curve down. You remember we were talking about that at the start of the pandemic, where the cases are taking off in this sort of fashion where it doesn't look that steep initially, but the numbers start to jump and jump and jump. And so we will need to bend that curve down, try and flatten it and then bring it down so that the infection is no longer spreading in the wild. And our best wishes, of course, are with all those people in Sydney. What vaccination rates do we need to be safe as a community if this disease were to be out and about? Well, you'd need more than 80% of the population to be vaccinated, and that includes everybody. So at the moment, we don't have an approved vaccine for people under the age of 16 in Australia. Pfizer goes down to 16 years of age. In the US, they're using it down to 12 years old. And we're going to need to get down into the paediatric population as well, because the other thing that we do know is that any talk that this is a benign disease or that it doesn't spread amongst children is all nonsense. Any talk that schools are completely safe is all nonsense. It spreads just as easily, and although it's less common, it does unfortunately cause the death of children. And we also know now that it's causing long-term problems for quite a percentage of kids, possibly 6% or so, who still have symptoms months and months after having the virus that are affecting their lives. And we don't want to sign our kids up to some unknown potential future complication from this virus, which we do know from all our experience of childhood vaccines is going to be much worse than any vaccine. So hopefully we'll urgently get approval for safe vaccines for children right down to a very young age soon. So stay safe in the storms out there in Perth. We're not used to having bad weather here. Look after one another. Consider those in Sydney. And as soon as you're eligible for a vaccine, then I think you should consider having it. Thanks very much.
That was Dr. Andrew Miller. And that's WP for this week. We'll be back again next time, but for now, it's back to you.
Thank you, Nelson. And here's Leo with what's coming up on 6 News tonight.
Thanks to us tonight on 6 News. Breaking news: millions of Sydney-siders still under tough restrictions as COVID case numbers continue to rise. Gladys Berejiklian warning that unless vaccination rates improve, thousands of people will be hospitalised and potentially die. Plus, international travellers arriving in Australia set to be asked which vaccine they've received and where they were given it as a new campaign to get the jab gets underway. Unrest in Haiti continues after the assassination of their president, but still little is known about the suspected masterminds and their motivation for the deadly attack. And a major announcement about myself, don't want to miss it. Full details on these stories and plenty more on our YouTube channel. Just search 6 News Australia to find us, and of course our website 6newsau.com. For now though guys, it's back to you.
Thanks Leo, and that's our weekly news and current affairs. We have the latest news on our website, wamnnews.com.au.
We hope you've enjoyed our company as much as we have enjoyed yours. From Sarah and myself, we wish you good health, good night, see you next Sunday.
Thanks for stopping by.